The ketogenic diet aims to induce ketosis to burn more body fat. Knowing the signs of ketosis can help a person determine whether or not the diet is working. Ketosis is a metabolic process that occurs when the body begins to burn fat for energy because it does not have enough carbohydrates to burn. During this process, the liver produces chemicals called ketones. The ketogenic, or keto, diet aims to induce ketosis in order to burn more fat. Proponents of the diet claim that it boosts weight loss and improves overall health. According to one 2018 study, people following a well-formulated ketogenic diet typically eat less than 50 grams of carbohydrates per day and around 1.5 grams of protein per kilogram of body weight. Despite these guidelines, some people following the diet may not know when they are in ketosis. In this article, we list 10 signs and symptoms that may help a person determine whether the ketogenic diet is working for them. 1. Increased ketones. Having ketones in the blood is probably the most definitive sign that someone is in ketosis. Doctors may also use urine and breath tests to check for ketone levels, but these are less reliable than blood samples. A special home testing kit allows people to measure their own blood ketone levels. Or, a doctor may take a blood sample and send it away for testing. When a person is in nutritional ketosis, they will have blood ketone levels of 0.5 to 3 millimoles per liter. Alternatively, people can use a breath analyzer to test for ketones in their breath, or they may use indicator strips to check the urinary levels. Ketone testing kits are available to purchase online. 2. Weight loss. Some research suggests that this type of very low carbohydrate diet is effective for weight loss. Therefore, people should expect to lose some weight when in ketosis. The results of a 2013 meta-analysis that examined the findings from several randomized controlled trials suggest that people following a ketogenic diet may lose more weight in the long term than people following a low-fat diet. People on a ketogenic diet may notice weight loss in the first few days, but this is typically just a reduction in water weight. True fat loss may not occur for several weeks. 3. Thirst. Ketosis may cause some people to feel thirstier than usual, which may occur as a side effect of water loss. However, high levels of ketones in the body can also lead to dehydration and an electrolyte imbalance. Both of these reactions can cause complications. Research into ketogenic diets for sports performance lists dehydration as a side effect of ketosis. Athletes may also have a higher risk of kidney stones, which is a complication of dehydration. To avoid dehydration, drink plenty of water and other liquids. See a doctor if symptoms of dehydration, such as extreme thirst or dark-colored urine, occur. 4. Muscle cramps and spasms. Dehydration and electrolyte imbalances can cause muscle cramps. Electrolytes are substances that carry electrical signals between the body's cells. Imbalances in these substances lead to disrupted electrical messages that may cause muscle contractions and spasms. People following the ketogenic diet should ensure that they are getting enough electrolytes from the food they eat to avoid muscle pains and other symptoms of an imbalance. Electrolytes include calcium, magnesium, potassium, and sodium. A person can get these from eating a balanced diet. However, if symptoms persist, a doctor may recommend supplements or other dietary changes. 5. Headaches. Headaches can be a common side effect of switching to a ketogenic diet. They may occur as a result of consuming fewer carbohydrates, especially sugar. Dehydration and electrolyte imbalances can also cause headaches. Ketosis headaches typically last from 1 day to 1 week, although some people may experience pain for longer. See a doctor if headaches persist. Interestingly, some recent research suggests the ketogenic diet as a potential treatment for migraines and cluster headaches. For example, a 2017 study proposes the diet for people with episodic and chronic migraine. Also, one 2018 study suggests the ketosis diet as a possible treatment for those with drug-resistant cluster headaches. However, much more research is necessary to confirm the diet's effectiveness for treating or preventing these types of headaches. 6. Fatigue and weakness. In the initial stages of a ketosis